Pulmonary hypertension. Pulmonary hypertension is a type of high blood pressure that affects the arteries in your lungs and the right side of your heart. In one form of called pulmonary arterial hypertension (PA), blood vessels in your lungs are narrowed, blocked or destroyed. The damage slows blood flow through your lungs, and blood pressure in the lung arteries rises. Your heart must work harder to pump blood through your lungs. Therefore, the extra effort eventually causes your heart muscle to become weak and fail. In some people, pulmonary hypertension slowly gets worse and can be life-threatening. Although there's no cure for some types of pulmonary hypertension, treatment can help reduce symptoms and improve your quality of life. Causes of pulmonary hypertension. Your heart has two upper chambers, atria, and two lower chambers, ventricles. Each time blood passes through your heart, the lower right chamber, right ventricle, pumps blood to your lungs through a large blood vessel, pulmonary artery. In your lungs, the blood releases carbon dioxide and picks up oxygen. The blood normally flows easily through blood vessels in your lungs, pulmonary arteries, capillaries and veins to the left side of your heart. However, changes in the cells that line your pulmonary arteries can cause the walls of the arteries to become stiff, swollen and thick. These changes may slow down or block blood flow through the lungs, causing pulmonary hypertensions. Pulmonary hypertension is classified into 5 groups, depending on the cause. 1. Pulmonary arterial hypertension (PA). Causes include: unknown cause, idiopathic pulmonary arterial hypertension, a genetic mutation passed down through families, heritable pulmonary arterial hypertension, heart problems present at birth, congenital heart disease, use of some prescription diet drugs or illegal drugs such as methamphetamines and other drugs, other conditions, such as connective tissue disorders, scleroderma, lupus, others, HIV infection or chronic liver disease, cirrhosis. 2. Pulmonary hypertension caused by left-sided heart disease. Causes include: failure of the lower left heart chamber, left ventricle, left-sided heart valve disease, such as mitral valve or aortic valve disease. 3. Pulmonary hypertension caused by lung disease. Causes include: chronic obstructive pulmonary disease, COPD, long-term exposure to high altitudes in people who may be at higher risk of pulmonary hypertension, obstructive sleep apnea, pulmonary fibrosis, a condition that causes scarring in the tissue between the lungs' air sacs, interstitium. 4. Pulmonary hypertension caused by chronic blood clots. Specifically, causes include: chronic blood clots in the lungs, pulmonary emboli, other clotting disorders. 5. Pulmonary hypertension triggered by other health conditions. Causes include: blood disorders, including polycythemia vera and essential thrombocythemia, inflammatory disorders such as sarcoidosis and vasculitis, kidney disease, metabolic disorders, including glycogen storage disease, tumors pressing against pulmonary arteries. Symptoms of pulmonary hypertension. The signs and symptoms of pulmonary hypertension develop slowly, so you may not notice them for months or even years. In particular, symptoms get worse as the disease progresses. Pulmonary hypertension symptoms, such as bluish color to your lips and skin, cyanosis, chest pressure or pain, dizziness or fainting spells, syncope, fatigue, shortness of breath, dyspnea, initially while exercising and eventually while at rest, racing pulse or heart palpitations, swelling, edema in your ankles, legs and eventually in your abdomen, ascites. Pulmonary hypertension classifications. Once you've been diagnosed with pulmonary hypertensions, your doctor might classify the severity of your disease into one of several classes, including: Class 1. Although you've been diagnosed with pulmonary hypertension, you have no symptoms with normal activity. Class 2. You don't have symptoms at rest, but you have symptoms, such as fatigue, shortness of breath or chest pain with normal activity. Class 3. You're comfortable at rest, but have symptoms when you're physically active. Class 4. You have symptoms while at rest and during physical activity. Risk factors. Growing older can increase your risk of developing pulmonary hypertension. Moreover, the condition is more often diagnosed in people ages 30 to 60. However, idiopathic PA is more common in younger adults. Also, other things that can raise your risk of pulmonary hypertension include a family history of the condition, being overweight, use of certain weight loss drugs, blood clotting disorders or a family history of blood clots in the lungs, exposure to asbestos, use of illegal drugs such as cocaine, genetic disorders, including congenital heart disease, living at a high altitude, use of selective serotonin reuptake inhibitors, SSRIs, used to treat depression and anxiety. Complications. Complications of pulmonary hypertension include right-sided heart enlargement and heart failure, cor pulmonale. In cor pulmonale, your heart's right ventricle becomes enlarged and has to pump harder than usual to move blood through narrowed or blocked pulmonary arteries. At first, the heart tries to compensate by thickening its walls. At the same time, expanding the chamber of the right ventricle increases the amount of blood it can store. However, these changes create more strain on the heart, and eventually the right ventricle fails. Blood clots. Specifically, having pulmonary hypertension makes it more likely you'll develop clots in the small arteries in your lungs. It is dangerous when you already have narrowed or blocked blood vessels. Arrhythmia. Pulmonary hypertension can cause irregular heartbeats, arrhythmias. Also, it can lead to a pounding heartbeat, palpitations, dizziness or fainting. On the other hand, certain arrhythmias can be life-threatening. Bleeding in the lungs. Specifically, pulmonary hypertension can lead to life-threatening bleeding into the lungs and coughing up blood, hemoptysis. In particular, pregnancy complications. Pulmonary hypertension can be life-threatening for a woman and her developing baby. Thank for watching. Good health. Do not forget like, share, and comment with us.